Dr. Caldwell is a board-certified, well-credentialed pediatrician from Virginia. I had the pleasure of being live with her a couple weeks ago at the Thornton's home in Virginia, and we'd like to turn it over to you, Dr. Melanie, for your experience with the past 25 years in traditional Western medicine and how you've integrated NICA and wellness into your practice and your vision for the future. Thank you.
As Madeline mentioned, I am a pediatrician that's been practicing for the last 25 years. And in the first 5 years of my practice, I basically came out of a traditional medical school training and a traditional residency. And after about 5 or 6 years, I recognized that I continued to see children sick over and over again, despite the fact that I was practicing traditionally the way I had been trained. So at that point, I really had a heartfelt conversation with myself and decided either I was going to leave pediatrics and seek another profession, or I needed to find out what was happening to our children, because I went into pediatrics to help families raise healthy children, and I felt like I was not impacting the health and the lives of the children at that time. It was at that point that I met a unique consultant, and things changed from there on. One of the things that I want to say is that as a pediatrician, I see several chronic illnesses, and most of the illnesses are, rather than acute, they're more on the chronic level. But if I were to mention the first, say, 4, that would be obesity, asthma, allergies, and ADHD/neurodevelopmental issues in children. However, over the last several years, what I've noticed is I'm seeing more and more neurodevelopmental issues. Not that I'm not seeing the other chronic illnesses that we talked about, but my biggest concern is the neurodevelopmental issues in children. And I would say I spend about 85% of my day talking about neurodevelopmental issues, anywhere from ADD to ADHD, autism, language delays, speech delays, anxiety, OCD, all types of neurodevelopmental issues. And I believe that the reason we're seeing this is primarily because of our lifestyles. In particular, I want to focus on sleep. You can only imagine how complex the brain is. And so from the time of conception until that child reaches adulthood, that child's brain is growing and developing. And it's a very complex structure, and the nerves and the nerve cells need to communicate very efficiently in order to grow a healthy brain. Well, because of our lifestyles, in particular electromagnetic fields, cell phones, Wi-Fi, computers, tablets, you name it, I would say on average, most families have at least 5 internet-connected devices in their home. And as a result of that, and the level of radiation that these devices put out, it far overwhelms the body's electrical circuit, because our body's electrical as well. And these cells communicate, as I mentioned, by electrical impulses. Once you put these children into an environment that has the levels of electromagnetic radiations, for example, with Wi-Fi being 2.4 to 5 billion hertz per second, and now these smart meters that are on homes that put out some 900 billion hertz per second. So when I talk about sleep, I am talking about sleep hygiene. And there are 2 components to good quality sleep. One is not only the length of the sleep, and in children, depending on their age, they need anywhere between 8 to 12 hours of sleep. And the second component being REM sleep. So the depth of the sleep is very, very important when we're talking about growing a healthy brain. And what I can tell you from what I hear from my parents is most of the children are not sleeping. And they might appear to be in a restful state, you know, for 8 to 10 hours. But if you look at them, they're very restless. They're tossing and turning. And as a result of that, we know that is not good quality sleep. So it is my opinion that this is contributing to a lot of the neurodevelopmental issues that we see in children, because we know how important sleep is and its impact on our nervous system.
Dr.
And
Melanie,
remember, we sleep primarily for our nervous system. So in my practice, one of the things I'm excited about is that I've been able to introduce a number of Nikin products that have helped these children tremendously, not only with sleep, but other chronic issues as well. For example, I have a ton of asthmatic children, and that's a chronic illness as well. And many of these children, their primary symptom, when it's poorly controlled, is nighttime cough. So as a result of them coughing mostly during the night, we know they're not getting a good quality rest. So if they're not getting a good quality rest, their immune system does not get strengthened. They're not absorbing nutrients that they take in for the day. Their body's not restoring. So there are a number of things that are very important that should be happening during sleep that do not happen when you have chronic illness. So as a result, these children have recurrent asthmatic symptoms that are out of control and requiring multiple medications. So the Nikin products, not only the sleep system, however, the air purifier, the athletic band that we have, they have been a tremendous benefit to a number of my patients. With regard to obesity, we know children's lifestyle today is very sedentary. Our children are doing a lot more with computers and technology, which is a more sedentary lifestyle. You know, schools have removed PE from the curriculum. That further makes these children very sedentary. We know that their nutrition is not very good as well. But one other thing I'll add to that, I know for myself as a pediatrician, I have so many children that have asthma, and the mainstay of treatment for asthma has not changed in 25 years that I've been practicing. In fact, when I graduated from medical school, or from my residency, the treatment was albuterol inhaler, and children that had chronic asthma were also on an inhaled steroid, and then during the acute exacerbations, these children would be put on prednisone. Well, I don't know if you're aware, but prednisone has tremendous side effects, one of them being weight gain. So I am iatrogenically causing some of these issues in the childhood obesity as well. However, these children need to breathe, and so it's ABC. I really don't have a choice until Nikin. Now, with just adding an air purifier and cleaning the air, and sometimes I'll add jade greenzymes, which are a wonderful benefit for children with allergies and asthma and anti-inflammatory. The magnetic products also have enhanced the quality of life in many of these children.
The water, can you mention the water as well?
Oh, yeah, the water goes without saying. You know, we know our body's 70% water. The brain is some 85% water. So water is absolutely critical. I have used the water for a number of chronic illnesses, but the one I'm really excited about is I've changed the life of a young lady who had sickle cell disease at 6 years, well, all her life, but at 6 years old, she was on morphine, and simply adding the water has changed her life and the life of this family tremendously. She used to be in the hospital every 1 to 2 weeks for IV infusions, which is basically all we have to offer children with sickle cell. Just keep them hydrated. However, the alkaline water has proved to be a tremendous benefit, and this child with sickle cell has not been back to the hospital at all for at least 2 years since I introduced our PyMag waterfall.
Dr. Melanie, we just have a few minutes left, and you've mentioned a lot of medical diagnoses, and one disclaimer that we need to give is that we're a wellness company, so it's basically good air, water, food, sleep. Sure. So could you just kind of segue as you finish your last few minutes about the importance of prevention and kind of tying it back to teaching parents and why you'd like to be involved in a bigger role, how you can see that you can impact more people. If you could do that, please.
Sure. Well, as I mentioned earlier, I was I was considering, changing professions because I was so disheartened by the fact that there were so many limitations with just traditional medicine. And so the fact that I have been able to introduce these products, and it really has impacted the quality of lives of these family and these children, has really energized me and made me more enthusiastic in terms of, practicing pediatrics. So my hope is that in the future, I'm able to transition my practice. I already have a wellness practice, but I'd like to do a little bit more than what I'm doing, and actually, able to be able to share with more families some of these Nikin products. So, that's what my goal is, to actually transition into a full, almost Nikin practice if I could.